Morning Show.
All right, y'all, Rickey Smiley Morning Show. Hey, everybody, listen. Dr. Carly, I'm so happy to have you this morning. And thank you for coming on, keeping everybody healthy. And as a matter of fact, Dr. Carly, I took my 5,000 international units of vitamin D yesterday in my omega fish oil and all of those other vitamins that came from your office, your own vitamins. So y'all make sure y'all go to lipodrops.com, and keep your immune system up and give your body a chance to fight off disease. I sound like the doctor. Go ahead. I'm through talking.
Thank you very much, Rickey Smiley, and good morning. Good morning, Rock P, Special K, Gary with the T, Alfredus, and the Brat. And thank you, Rickey, once again for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Rickey, today's Wellness Wednesday, we're going to address the question of what over-the-counter pain medication to take, how and when to take them. There are several over-the-counter medications available to take, and I'm often asked the questions like, which one is the best? Which one is the strongest? Which one is it safe to take? Of course, the most commonly available pain medications include Tylenol or acetaminophen, which is a centrally acting non-opioid pain medication. It acts as an analgesic for reducing pain and an antipyretic for reducing fever. It also is very safe for children to take. As a matter of fact, it was first developed for use in pediatric patients with pain and fever. The standard dose for Tylenol is a 325 milligram tablet. It can be taken 2 tablets every 4 to 6 hours. The extra strength version of Tylenol is a 500 milligram tablet that can be dosed 2 tablets every 6 hours. And the arthritis pain strength of Tylenol, that's an extended release formulation. So that is a 650 milligram tablet that you can take 2 tabs every 8 hours. Rickey, Tylenol is most effective for pain, for mild pain not caused by inflammation, such as arthritis pain, tension headache, or body aches related to a cold. Now, the remaining classes of drugs all fall under the class of what's called non-steroidal anti-inflammatory drugs, or NSAIDs. This class of medication is used for reducing pain and reducing inflammation, in addition to reducing fever. Options include ibuprofen, name brands Motrin and Advil. It comes in a 200 milligram tablet. The standard dose is 1 or 2 tablets every 6 to 8 hours. NSAIDs are best at treating inflammatory-related pain, such as inflammation in osteoarthritis or rheumatoid arthritis, dysmenorrhea, which is the big word for menstrual cramps, migraine headaches, toothaches, muscle strains, injuries like cuts, any mild or moderate pain, and, of course, fever. These are also used for acute pain injuries like musculoskeletal strains, sprains, and other injuries. The recommended dose of Motrin Advil is 200 milligram tablets every 4 to 6 or 8 hours, depending upon your level of pain. Motrin Advil is also available in the children's liquid formulation at 100 milligrams per teaspoon. That's a liquid. So 1 teaspoon is 5 mils. And the dose is usually 1 teaspoon per child. In an older child, you can give them 2. Finally, Rickey, naproxen sodium, name brand Aleve. Aleve comes in a 220 milligram tablet. You take 1 or 2 tablets every 8 to 12 hours in ages 12 or older. So you can't give this.
And that's for what, Dr. Collier, the Aleve?
Aleve is for also for pain and inflammation, but it lasts longer and is more potent. So you can literally take 1 tablet every 12 hours and get a good pain relief with Aleve. For more severe pain, you can take 2 tablets up to every 8 hours. But there's no pediatric version, so there's no Aleve for children. Just for adolescents, age 12 and older, you can take it. So NSAIDs are contraindicated, Rickey, if you take blood thinners, and should be taken with caution if you have high blood pressure, if you're pregnant, if you have kidney, liver, or heart disease. Tylenol can be safely taken if you have blood thinners. That includes Plavix, warfarin, which is Coumadin, Eliquis, Pradaxa, and Xarelto. A lot of people take blood thinners because of atrial fibrillation, or they've had a heart attack or a stroke, and so they cannot take, the only pain medication that they can take would be Tylenol. So, Rickey, for any of these medications, you use the lowest effective dose for the shortest duration of time to get relief. So there you have it. That's good information for the listeners of the Rickey Smiley Morning Show.
Dr. Collier, Rock T didn't want to ask us on the question because he didn't want to get attacked by a lot of people in where him and Crystal live. If you're a little person, do you take a half a Tylenol or do they need to take a whole one?
based on age and weight.
Okay.
Based on age and weight. So if you're an adult little person, you can take the standard dose.
No,
so that's actually a good question, Ricky.
Yeah, you could ask that yourself. You sit right here laughing and stuff. Takes me while you talking about asking.
Right.
And then he didn't say little people. He said midget. And I said, you can't say that. That's politically incorrect. You say little person.
Rocky used the M word. No, he didn't.
You already know
Yes, he
that.
did. Let's go to the phones. 8669 Ricky 8669 RICKEY. Good morning. You're on with Dr. Collier.
Yes, I have a PSA of 5.0, and I was wondering if that requires me to get a biopsy for my prostate.
Yes, because normal is less than 4, and for African American men, we really like for it to be 2.5 or less. So 5.6 at minimum, you should get an ultrasound of the prostate. They have a specific type of ultrasound and or MRI now. It's the newest technology that can show whether there's anything to biopsy. Then, if necessary, you can get a biopsy. But normally, if the PSA is between 5 and 10, it is usually due to prostate enlargement. So if you have benign prostatic hypertrophy, if it's greater than 10, then you always need to rule out prostate cancer. But in African-American men, genetically predisposed to prostate cancer and the highest death rates, I would say with 5.6, after the MRI of the prostate, I would definitely, the biopsy is the only test that answers the question. Everything else is just a picture of what it could be and cannot rule out, etc. But the prostate biopsy will give you peace of mind. If it is cancer, you get early diagnosis to get treated. If it's not, then you know you don't have to worry about it. You just have an enlarged prostate and you have an elevated PSA. That's prostate-specific antigen, the blood test used that's required when you get a comprehensive physical examination as a male.
All right, y'all. I need y'all to get on the phone. Hey, if you have any medical questions for Dr. M.J. Collier, hit me up at 866-9-RICKY, 866-9-RICKEY. Hey, we're going to be taking more of your phone calls coming up. Rickey Smiley Morning Show.
Yeah, I want to ask you a question about constant urination. Because I've tried every prescription drug there is, and nothing's working. I want to ask them, what can I do?
If you're having problems with urination, there are several disease states that can be responsible for that, predominantly high blood pressure and diabetes, but there's also needs to be a real evaluation to determine what's called urodynamics, to see what your bladder capacity is and to see if there's a problem with the amount of urine that your bladder can hold. Lastly, you need to do Kegel exercises so that you can control and hold it until it's time to get to the bathroom. And those Kegels are just where you're urinating and you try to cut off the urine flow. You squeeze and you do that. Do those exercises. I recommend doing them like if you're watching television when a commercial comes on. Just do a set of 10, and that will increase and enhance your ability, your sphincter tone for your ability to hold urine in.
What the hell you just said, sir?
I didn't know men did that.
What kind of
I didn't know men
exercise?
could do that.
Oh, yes. Kegel exercises are good for men and women. The pelvic floor is the pelvic floor. So it makes a woman's, it helps with her urination, but also makes the vagina
get all
tight.
the urine out right at the end. Tell me that.
Well, yes, but the problem is as we age, the elasticity of the bladder changes. So our ability to empty the bladder, we have to change our culture. You have to stand there, excuse me. You have to stand there, wait for the bladder to empty, wait for it to get the urge again, and then wait for it to empty. Otherwise, if you're rushing, you'll urinate, you'll zip your pants up and go wash your hands. And before you wash your hands good, you feel the urge to go again. So part of the culture with older men, it has to be you have to give your bladder time to empty. So even when Dr. Collier goes to the bathroom in a public place, I'll be like a movie theater or a sporting event. 2 or 3 young guys may come and go while I'm still standing there. And so, but once I'm finished, I'm finished. Other older guys who rush in and out, they're right back in the bathroom 15 minutes later with that problem.
Yeah, because you got that extra drip.
Yep.
You got that extra drip, you got to take care of it.
That big old pea spot be in your.
That's why I wear a panty liner.
Yeah, yeah.
I wear panty liners.
Say, man.
All right, let's go.
Believe it or not, a lot of men do just for that reason.
Yeah. Yeah, I've been using Bounty. It's the quicker picker-upper. All right, let's go to the phones. 866-9 Ricky. You on with Dr.
Put
Collier?
a Nike sock down there.
Yes, I have a question about penile enlargement. Is there a medical procedure that could make it bigger?
That actually is a surgical procedure that was started out in California, where they would take the penis and they basically just take it and pull it forward. It's attached by a ligament to the pelvic bone, and they release that ligament and extend it out further. But there's no other real therapy that makes it bigger or longer. That just extends what you already have. There have been cases where they have injected fat cells, just like a woman gets a butt lift. They can take fat from your abdomen or your butt and inject it into the penis. But I've never seen that come out good cosmetically. It always makes the penis look lumpy and weird.
Do they call that a PBL?
Dr. Carter make a thing look like
That's a good question.
Like it got a double chin.
A triple chin, a quadruple chin. It's just lumpy. It's very difficult to smooth that out. So, an experienced doctor might be able to do it, but really, you just kind of have to go with what God bless you with and be happy.
Start dealing with smaller women, sir.
Sir.
He got that lumpy joke.
Are you talking about high challenge people or little people?
Yeah, just start dealing with only little people.
Yeah, sir. You might need some hot water, because when I be boiling them hot dogs for the hot dogs for the cookouts, the hot dogs, the ballpark franks, they grow in the pot. You might want to sit in a jacuzzi.
They plump when you cook them. They plump when you cook them. Rickey Smiley, I want all your listeners to subscribe to my YouTube channel, Ask ASKDRMJ, where we have hundreds of videos on various healthcare topics. I don't have one on penile enlargement, but I will put one up. Go to my official website, lipodrops.com, where you'll find information on various supplements like vitamin D3 at 5,000 international units per day. Follow me at AskDRMJ on all social media platforms. And remember, these are the opinions of Dr. MJ Collier, not those of Rickey Smiley. The Rickey Smiley Morning Show cast Super Days, Rock T, or its production crew. Stick stay. Don't you dare go away. You're listening to Dr. MJ. No secrets on penile enlargement, just good health care on the Rickey Smiley Morning Show.
Dr. Carly, say good morning to my nephew, Brandon Connor. He texted me, he said, man, I had to pull over. I can't breathe.
Brandon, good morning, sir. So good to talk, and thank you for being a loyal listener.